My name is Chris Gentchos. I'm a board-certified orthopedic surgeon with a specialty in foot and ankle reconstructive surgery and care. I grew up outside of Philadelphia, and I went to high school in Center City, Philadelphia, St. Joseph's, and I have a degree in chemistry from Dickinson College with a minor in Greek and Latin, ancient languages. I went to Georgetown Medical School and did my orthopedic training at Wayne State University, where I had an interest in trauma. So when I finished orthopedic training in Detroit, I served active duty in the United States Navy. Between reserve and active duty time, I spent 13 years in the Navy, and I finished as a lieutenant commander. I was stationed in Newport, Rhode Island, and served on the USNS Comfort hospital ship, and I was stationed with the Marines, 2nd Med Battalion, Combat Logistics Battalion, where I ran the surgical company. I did 2 combat tours in Iraq, and returned and joined Concord Orthopaedics. In the interval after leaving the service, I trained with the Michigan State Group in West Michigan, and completed specialty training in foot and ankle surgery based on interests that I acquired in this service, mainly regarding reconstructive procedures and focus in wound care and management. Since then, I have been a foot and ankle specialist here in Concord, and I practice out of our office here in Concord, in Derry and in Windham. And I have an interest in wound care and complex reconstructive surgeries of the foot and ankle. I decided to go into medicine because I was told to go into medicine by my grandmother. So when I was a little kid, she told me that you're going to be a doctor someday. She told that to my dad, and he became a doctor, so it kind of rubbed off. I worked in his office as a kid. I would clean up the office, I would file, and I used to get up really early in the morning, and I would never otherwise see my dad, and he would take me to the hospital, and I would make rounds with him, and I'd go to the office with him, and even as a little kid, I watched him do surgery. And I found it very fun and exciting, and he loved what he did, and I wanted to do the same thing. I met my beautiful bride when I was in Detroit. She was Canadian, and she knew that I was very into trauma. And working at Detroit Receiving Hospital, it was hard not to be intoxicated by the intensity of the trauma. And she put no restrictions on my career choice, except she said, do not do trauma. Having said that, a significant portion of foot and ankle reconstructive surgery is dealing with acute and then the subsequent care of trauma. So in one sense, I got around that prohibition. And I have a little tiny place here in Concord that I call my farm. I grew up in New Jersey, right outside of Philadelphia. My backyard was Patco, which is an express train to downtown. It ran every 8 minutes, one way, every 8 minutes the other. So every 4 minutes the train was going by. And it was real city life. Here I've got my half acre, and I've got 3 apple trees, 4 pear, 1 peach, 2 cherry, and my row of blueberries, blackberries, and raspberries all crammed in there. My wife thinks I'm crazy, but it's my farm and my hobby.